This Sunday on Press Pass, doctors across the country are worried about what could be a long winter health-wise. The hospitals are seeing a big spike in RSV cases, the virus that primarily affects children. At the same time, COVID vaccination rates are starting to drop as Americans get ready to go into the holiday season. It's fueling concerns that a potential tripledemic is mounting, along with the potential resurgence in COVID cases and flu season picking up. So here to weigh in on what we're seeing locally, we have Dr. Therese Lennon with the Akron Children's Hospital. Thank you so much for joining us this morning, Dr. Therese.
Sure, thanks for having me.
Now, how common are RSV cases? I mean, hasn't this virus been around for a while? What should parents even be watching for as this virus kind of persists?
So RSV, or respiratory syncytial virus, is a very common respiratory virus, and it's not new. We've seen it for years. The reason why we're seeing a surge this year is because there were lower cases in 2020 and 2021, and without having a lot of cases in our population, our group population immunity has not carried over. So cases this year have been a lot greater, and not only have they been greater, but they came a lot earlier than was typically expected. In regards to what parents should watch for, RSV is a common respiratory virus. So in most cases, it will present like a common respiratory virus would, with symptoms of the common cold: cough, runny nose, sneezing, fever. But in some cases, especially those kids that are vulnerable to it, it can be pretty dangerous. It can cause an infection called bronchiolitis, which is similar to pneumonia. And those kids who are most at risk for that bronchiolitis infection from RSV include kids under the age of 2, those who are former preemies, those who have sensitive or underlying lung disorders, those with underlying heart disorders, and those with underlying immunity problems.
So would you say that, the practices that kind of got us through the pandemic, like, social distancing, mask wearing, could be kind of what's fueling this surge in RSV cases for younger children?
So it's not that they've surged it, but perhaps that those practices decreased our population burden for 2020 and 2021. And in so doing has decreased our group immunity that typically carries over from season to season.
Okay. Now we're seeing reports of hospitals filling up with RSV cases, and it's kind of overwhelming the doctors and the nurses. What's it look like here at the local level? Are you seeing these viruses, or are you seeing this virus kind of, a little bit? I know you're saying it's not like a surge, but what are you seeing then here locally? Like, what does it look like for us?
Oh, we're definitely seeing a lot of this. It's the most common virus that we are seeing when we are testing for it. We don't test every sick kid that walks into the office, so the cases that are out there are far greater than what we've even tested for. But out of those that have been tested, RSV is our #1 virus at the Akron Children's Hospital, accounting for about 40% of all cases of kids with the respiratory illnesses. Last week in the hospital, they had to hospitalize 80 children. So those are kids that had infection that was severe enough that required a hospital stay.
Oh my God. I mean, this has got to be, stressful for parents. That many kids being, hospitalized with this virus. I'm wondering, for those parents whose kids might be experiencing these types of symptoms, how can they treat this at home? And when should they be thinking about taking their kid to the urgent care and to the hospital? Is there a point of time where they can wait so maybe the hospitals don't fill up as much, or do they need to go immediately? Tell me about that.
Right. So if your child is not at high risk and is just having the symptoms of the common RSV infection with a cough, a cold, a sneeze, a fever, you can treat them at home. And we would probably encourage you to do so, because keeping them at home is going to decrease the risk of somebody else being exposed to the virus. But if your kid is at risk, or if they start to show worsening symptoms, so it's harder for them to breathe. For babies, it becomes difficult for them to eat and to breathe at the same time. And so when that happens, they start to decrease the amount that they're eating, and they can start to show signs of dehydration. So that's a very big thing for RSV infections for the young infants. So if your infant is showing signs of dehydration, or they're showing signs that they're really struggling to breathe, then I would strongly encourage you to bring them to the office, or bring them to the urgent care, or bring them to the emergency room.
Okay, and what about if parents have any concerns, if, their kid has RSV and then they're at home with them, they possibly get it and then it just kind of spreads through the household. What would you say to them?
So it will, because RSV is a common respiratory virus. But the good news is most of us have had RSV at least once in our lifetime. And so we carry immunity to it. And so the burden on the adults is a lot less than it is on the kids.
Okay, and there's also reports of a looming tripledemic. Now that includes, these rising cases of RSV, but then also the flu season and a resurgence in COVID cases. So how likely are we to see this unfold?
Sure. So, like I mentioned, RSV came early this year. It typically comes in November. And then we don't usually see the surge of the RSV until the end of December. And we're already seeing rising numbers of the RSV infection. So, as we expect flu to be here any day now, I've already had a positive case in my office. Yeah, if flu gets out the way that the RSV virus has gotten out and we're not ready for it, and then another surge of COVID comes, it can lead to this tripledemic that the American Academy of Pediatrics has been warning us about.
And a spike in these all of these cases could really, kind of overwhelm our hospital systems this winter. Do you think that's possible, that we'll be hearing about doctors and nurses kind of being overwhelmed again?
I don't foresee that happening just yet. I don't think that there's a big panic in that way, but I will say that our offices, our urgent cares, our emergency department, our pediatric bed, and our ICU right now are definitely filling up with the RSV infections that we're seeing.
Okay, and one other thing here, three of the top four makers of the antibiotic amoxicillin are reporting supply constraints here in the U.S. Do you think we're facing a shortage of this drug, and what could that mean for children with infections this winter?
So yeah, I've definitely witnessed that as well. So I have seen less amoxicillin available in certain forms. So it will definitely affect us in regards to other infections, but when it comes to the specific RSV, it shouldn't, because RSV is a virus and we don't treat it with antimicrobial therapy.
Okay, could not even get it out there. Thank you so much, Dr. Therese, for
That's
joining
okay.
us this morning, and you have a great rest of your Sunday.